Hello, Nutrition 696R, and welcome to Step 1, the statement of the problem in solving your wicked problem. As you can see, I am here on Screencast-Matic, and I am using the function of both my webcam and my screen sharing. So you're welcome to use just a webcam or just share your screen or do a little bit of both. Sometimes if I'm recording in my pajamas, I just choose the screen, but most of the time I think it's helpful just to see my face and my expressions while I'm giving a lecture, and so I tend to share both the screen and the webcam when I give a talk. So it's totally up to you. Experiment with it this week and see what you think. So with our step 1 statement of the problem, we're going to be going through a number of different steps here and a number of different tactics to do this seemingly simple task. So when we look at the public health problem solving paradigm, we have a few different steps. So first, we need to define the problem. This is the statement of the problem that we'll be talking about today. After that, we need to look at the magnitude of the problem, some key determinants, some priorities in addressing this problem, and using your personal strengths in order to see what place you want to play in that, some program and policy development in order to address the problem, implementation of those programs and policies, and then evaluation of how it all went and what needs to be done a little bit differently in order to continuously improve. So when we look at the magnitude of the problem, we can look a lot at the burden of disease when we're looking at public health issues and nutrition-specific public health issues especially. So we can look at mortality or life expectancy, mortality rates associated with your wicked problem. Also morbidity, and morbidity can be defined in a variety of different ways. You could talk about incidence and prevalence of disease. You could talk about how the disease affects healthy or disability-free life expectancy. You can think about years of potential life lost, or PYLL, physically and mentally unhealthy days, so how many days you miss work, things like that, self-assessed health status, limitation of daily activities, or physical, mental, and social health-related quality of life, including well-being and satisfaction. So lots of different ways we can think about the effects that your wicked problem has on morbidity. Then we can also look at, the very direct and indirect costs. So in order to do that, you really need to define the perspective of what does cost mean, right? So is it cost to society, cost to the payer, cost to the government? And depending on how the data is presented and what measures are used, specific health issues and diseases end up being ranked in a different order based on, all these factors that we're looking at in terms of how much burden disease causes. So here's some sage advice about the problem statement. It's really important. So when we look at this, a problem well stated is a problem half solved. If you come up with your statement of the problem, you've really done a lot of work in terms of organizing yourself and how you're going to solve it. What are you going to be looking for in the literature review? There were a couple of you in discussion last week that did such a good job just really defining the problem and where you needed to look in order to get information to solve that problem. And so that's really the process that we're going through here. And so if I gave you the thumbs up or the green light, then you can, just keep on pushing through with that problem solving. If I had 60 minutes to solve a problem, I'd spend 55 defining it and 5 minutes solving it, because once you've defined that problem and defined the magnitude and the scope of the problem and think about what's already been done, then it's like, oh, well, this is what we'll do next, right? And then the solution to a public health problem depends on how the problem has been defined. And that is really different too. Some of you have similar interests. A few of you are interested in obesity. A few of you are interested in food intake habits, in waste, in lactation. Lots of you are interested in similar concepts, but perhaps you'll be approaching the problem or defining the problem in different ways and approaching it from different angles. So as you're navigating this and creating your little videos this week, I just really look forward to hearing how you plan to address your specific problem. So what is a health problem, right? It's a gap between acceptable or desirable health status and current status. And, we see this, I just put this little photo here because we see this on the aesthetic level, right? When we're looking at nutrition in the media or when we think about nutrition just in terms of energy balance, right? There's a gap between how you look now and how you want to look, right? That's really how we see nutrition in the media. But when we take a step back and really dig in and really look at this, from a public health perspective, there are so many more important messages that we can be sending to the general population. And let's think about those messages. Let's think about the importance of some of these wicked health issues that we're addressing and how to solve them throughout the year. So just really let this statement of the problem be a passion for you and a drive and say, how do I want this statement of the problem to be addressed to the general population, to change policy? What would the world look like if we could stop just looking at before and after photos and think about nutrition from, a much more deep and and thoughtful perspective, right? And we have a say in that as nutrition professionals. So to write your problem statement, you're going to briefly answer these questions. So what should be occurring and what is occurring now? So why is it a problem, right? Who's affected by what's occurring now and to what degree? What could happen if the problem isn't addressed? So what's the consequences of not intervening at this point? And why are you so passionate about this? Then describe the determinants. So what are the problem causes and what are the factors that contribute to the continuation of this problem? You can use the health status indicators to answer these first three questions, and this presentation is available in the non-video format in this lecture section as well. So you can just click on this CDC link in order to find that on your Blackboard page. So the problem statement. Dimensions. So first you need to clearly identify the needs or the problem, including its incidence and the characteristics of the most affected. Such identifying information might include 1, the number of people affected by the problem, and among those people, the following factors. So what are their age and genders? What are their ethnicities and languages spoken? What are their income and education levels? What are their health statuses aside from the wicked problem you're addressing? And what does their family structure and family size look like? And where are they located geographically, or how is the distribution of those family members as well? So here are some examples. So the problem definition is the single most important step. So you have a lot to do in these next few days thinking about this statement. It involves stating the problem, the population affected, the context, which is the geographical, economic, historical, and ethnic context, and the time frame of the problem. So here are some examples. The incidence, number of new cases, specific measure, of obesity, the health issue or problem, in Jefferson County, which is the geographic area, residents over 21 years of age, by age, has increased over 3-fold a specific amount over the last 40 years, time frame. So, you defined that in one sentence, but the amount of research that needed to go into that one sentence is no joke, right? We needed to do a lot of digging to figure out all of these specific details. Or the problem is defined as blank and found in the provide the populations affected here. On the local level, the problem affects a certain number of people each year, while the incidence of the problem on the state and national level is blank and blank respectively. Over the past blank number of years, the problem has improved, worsened, or stayed the same, and the reason is blank. And this just sets you up to say, how are you going to solve it and why, right? This will lead you to that, even if you haven't defined it yet. So the health problem, the causes and factors. So we need to describe the determinants. So what are the causes and factors that contribute to the continuation of the problem? So there can be genetic or biological factors, demographic factors, psychological factors, behavioral factors, the physical environmental factors, social and cultural environmental factors, economic factors, issues related to the health system, as well as political factors. So a way that you might write this is the causes of the problem are blank. The major causes of this problem on the local level appear to be blank. The local level problem is different from or is unique from the state or national data because blank. So for example, I live in Holyoke, which is a food desert, and we have a much higher rate of childhood obesity in Holyoke than in other parts of Massachusetts. And I might say something like, the major cause of childhood obesity in Holyoke is, food insecurity and hunger and food desert of the city, and that is why that local level problem is different or is unique from the state or national data, because the way the city is set up and the socioeconomic status of the citizens that are in that city. And then the problem statement, the costs. In addition to the significant impact that the problem has on the individual, the problem costs blank in remediation, services, and prevention efforts. And of course, you don't need to pick all of these. You might just pick what you're focusing on. So if your focus is on childhood obesity prevention, you can look at the scope of the problem from prevention efforts and how much that costs, or how much the consequences of obesity cost as well. Other factors affected by this problem tell who and in what way. The consequences of not addressing the problem are blank, and or the benefits of addressing the problem are blank. So what's going to happen if you don't address it, and what's going to happen if you address it? How are the consequences going to be different? Lastly, you want to do a health problem analysis. In this process, you're going to categorize the causes as direct and indirect, and as risk and protective factors. You're going to weigh the factors and determine which ones are the primary factors, and then you're going to determine which of these factors can change as a result of the policy or the program, as well as think about how often does any given factor play a role. So when you go into your assignment section, you're going to see a health problem analysis worksheet. There's a sample worksheet, and then there's a blank one. So your homework this week is to fill out this worksheet, so complete this worksheet, and then write a statement of the problem. I've also put in an example statement of the problem in there, but you can also use this PowerPoint as a guide and this YouTube video as a guide to write your statement of the problem, and even use some of that language that's contained in here just as a framework to write your statement of the problem. So good luck to everyone. I really look forward to reading all your statements of the problem. And, over the next month or so, I'd really like to connect with each and every one of you as you jump in and start solving your problem to help you identify some resources you can be using for literature review and help connect you with each other for people who have specific interests that are really similar. So good luck, everybody. And I look forward to reading all of your work. Take care.